Okay, so Angie's going to demonstrate a squat for us. She has about a month left in her pregnancy. So her stance is a little bit wider than it maybe normally would be. And she's gonna go ahead and squat down to a depth that she feels good at. Come up, go down. And I want you guys to watch her rib cage. So you see how she's coming up and kind of thrusting it at the top like that? I want her to have her rib cage stack over her pelvis at the top there. So it's a little bit more of a neutral position. Notice she's squatting where her butt is not rounding over at the bottom. She's going down and then driving through her heels. So Angie, go ahead and pause there for a second. I want you to show what thrusting the rib cage looks like. Really like bring your chest up, eyes and chest up. Yep, so we see how her belly trajectory changed there. And I want you to find more of a neutral position where you just stack your rib cage over your hips, maybe like bring your feet so that you can feel the weight more over the center of your feet versus in your heels or your toes. You feel that. So you see her belly trajectory there. Now I want you to squeeze your butt because a lot of people come up and they finish their squat and they really kind of squeeze their glutes at the top of that movement. Can you try that? Go down and then come up and then squeeze, push your hips forward. Yeah, so we see that a lot. And I want you to look at what that did to her butt shape and also her belly trajectory. So now go back to your neutral, find that, weight over the center of your feet. Okay, now we're gonna talk to her about her breathing. Okay, she has two options here. For at this point in her pregnancy, I would suggest for her to exhale through the full range of motion. So what that looks like, eyes forward, is an inhale at the top, slowly exhale all the way through, okay? So we're gonna try that again, where she inhales, come up. So I want you to inhale, wide into your rib cage, slowly exhale, and then start your squat. There we go, and come up. So that actually gave her a little bit more range of motion, but you're going to finish at that neutral position. So I want you to inhale, exhale, and try to exhale before you start that squat. So inhale, exhale. Good. And another option, if that feels too hard because you get winded, is to inhale down and then exhale on your way up. And now exhale. Good. Okay. And so it's really just finding what feels more comfortable to you. You can leverage your breath and your positioning to change how much force is happening here. Because if she takes a big inhale, I want you guys to watch her belly. Big inhale. Now exhale. Okay. And I want you to think about inhaling into your rib cage and then exhaling, drawing the baby in. Good. Inhale wide, let your belly go. Good. Now exhale, bring the baby in. Inhale wide into your rib cage, let the baby go. Exhale, bring the baby in. Okay. So those are some good ways to kind of get connected to that core and pelvic floor system, but it doesn't have to be this overkill put into movement. So she can take a gentle inhale into her rib cage, let the baby go. Exhale, pull the baby in. And now squat, and good, come up. So these are some things to keep in mind, that neutral position, leveraging the breath, either an exhale through the full range of motion or an inhale down, exhale up, whatever feels more comfortable, and keeping that body weight over the center of her foot through that full range of motion. Do one more squat, Angie. Inhale, slowly exhale, and then squat. Good, and rack it.